trauma specialist at the New Hampshire Coalition Against Domestic and Sexual Violence, and she came to give us an overview of the ACEs study, which, you know, may have been a familiar study to many of us, but she also broadened that with giving us sort of a picture of what that looks like, what the effects of ACEs looks like in individuals in our communities and that we may be working with, and, you know, both physically, emotionally, behaviorally, and kind of what that looks like. And then she helped guide us into what the implications of this is for our work in prevention. You know, how do we take this knowledge of the fact that the prevalence of ACEs is very high and then translate it into the work that we do. So I'm just going to kind of look at some of her key slides to review for you. You may have remember these. So she gave us the overview of the study, right, where she showed us the research that was done and how it was done, and helped make that correlation between individuals who experience adversity and trauma during childhood to poor health outcomes in adulthood, and including, but obviously not limited to, substance use disorder. Right? So there's a higher correlation between people who have experienced ACEs and these poor health outcomes in adulthood. Right? And then she guided us through sort of understanding how that happens, and broadened this idea of what trauma and adverse experiences looks like. So you'll notice that, you know, the ACEs are up here, but below that she looked at intergenerational trauma, historical trauma, and so, and I think she gave, it was a personal example of what that looked like, how in her own life there was not a singular traumatic event, but because of the historical and generational trauma, the effects were the same. So there's that broader level of historical and generational trauma, and then moving up to that toxic stress and those social conditions that lead to the same outcomes. And then, obviously, those specific events in one's life that we refer to as ACEs, and how that then disrupts neurodevelopment and impairs social, cognitive, and emotional behavior. So kind of, and then I think how this is where we are, right? This is where we're coming in. Yes, there's a lot of work being done here to prevent any of this from ever happening. But once it does, if there's, when there are these traumatic events, how do we then approach those individuals in our communities to prevent any further negative outcomes, right, those high-risk behaviors? And she gave us some ideas around that. Right? So we talked about the trauma-informed approaches and the importance of those, and we were all able to share a lot of wonderful work that is being done across the state in increasing trauma-informed approaches, right? So when we do these trainings and trying to increase awareness throughout the community about how the widespread impact of ACEs, and that helping people recognize the signs and the symptoms of young people who have experienced trauma, making sure that we have the knowledge and the support to address that. And, one of the key parts of trauma-informed approaches is that seeking to avoid re-traumatizing the individual. Right? So seeking to not continue that traumatic cycle when we are responding in response. A couple of other things that she talked about. So what are the implications for prevention? And I think, we're obviously, in the work that we do, we're really trying to reduce those risk factors and increase the protective factors, so that, we're not, people aren't adopting high-risk behavior, right, including One of the big interventions that she talked about was this ARC framework. And the ARC framework looks at the building of attachment, right? That the attachment is that first, and the ARC framework is, she talked about how it can be both used in that individual and clinical intervention. So on that first, but it's also a systemic and organizational framework, so it can be used in our larger work. And that the ARC framework, the attachment, right, built in this, and we also talked about Maslow's hierarchy of needs and how these sort of model each other. And so attachment, building that attachment by strengthening caregivers' roles, right? Enhancing the supports and the skills and those relational resources between individuals and caregivers. And not just in the home, but also in our community organizations. So after school, child care settings, schools, youth groups, police forces, right? Building that that relational, that relationship level. The next level would be that self-regulation, because we know that young people who experience, or individuals who experience trauma when they're younger have a hard time often controlling their behavior and understanding their emotions, right? So that self-regulation, being able to make sense of and understand and sit with and be comfortable with these complex feelings that they have. And often that results in, or the, what's it called? Disorganized bodies, right? We see that a lot, the disorganized bodies, so helping with that self-regulation. And then the third part of this ARC framework was competency. So not just reducing pathology, not just, right, making, so it's not awful, but building up and enhancing and helping people thrive beyond just reducing the pathology. So what is that competency? It's really having that feeling of self-efficacy. I think one of the standout, I think a member, one of the participants said, yeah, sometimes clients are saying, I know how to survive down here. And as soon as I start getting up here, it's too scary, right? I don't know how to survive up here. And so we see that self-sabotage or ruining those opportunities because that competency isn't part of it. So helping build those competency skills of decision-making and choice points and really empowering empowering people, right? And this applies not only to people who have experienced trauma, but we kind of want this for everyone, I guess. It's kind of the goal, to thrive. But that's the framework that she presented as interventions for people who have experienced trauma. Right? This is sort of a, and they line right up with what we know for substance use protective factors, right? Protective factors for all people against developing substance use disorder. So, right, these are just a few that I pulled out in the individual and family and community domains, but these protective factors line right up with that ARC framework. What do people need? Right? What helps build their resiliency and make them able to make different choices in the event of adversity. And positive parent or family engagement is a huge one. Family support, connection. That's what we're seeing through all the research, is that connection, that relationships, developmental relationships are so important. So both at school and at home. The HOPE framework, has it been familiar with the HOPE framework, the health outcomes of positive experience, which is a new study on sort of how positive experiences reduce the effects of adverse childhood experiences, and these are the two highest experiences that can really mitigate the impact of ACEs. So feeling that someone stood by you, having someone to talk to about difficult feelings, and that really makes sense with what Linda was talking about. Somebody was saying to her that I'm addicted to not feeling my feelings. Remember when she said that, you know, that is feeling the feelings of the traumatic event is so difficult that you'll do anything to stop feeling those feelings. So if we can help young people, or anyone, adults as well, after the traumatic event to be able to process those feelings and be able to talk about them, then maybe they won't need to not feel them, right? So that makes sense, because that's a protective factor. And so the work that she talked about with the interventions for ACEs at our last meeting line right up with all the protective factors. You know, it kind of just, supports the work that we've already been seeing to be effective. And that's what I had as a summary of her, what we talked about with her last time. I just want to say, were there any things that anything that resonated with you from her presentation that were like aha moments, or something that you remembered, that stood out? Points that she made that were new or different or additional to what you already sort of knew about ACEs and the ACEs study and the work that we do?
Well, I loved the Jacob Ham video that she used about the brain, you know, the survival brain versus, and I've used that already with like a bunch of different staff members and kids, and I haven't gotten to do it at a faculty meeting yet, but, you know, in less than 3 minutes, it's a really, I think, nice presentation of that.
The survival brain versus the learning brain?
Yeah.
That was impactful.
The two videos that she shared are both posted on the Community of Practice website, so if anyone wants to look at those again or use them as a resource, they are posted there.
Okay. Anything else?
Looking at like a lot with both through the numbers she shared and her own personal experience, that the prevalence of this is really clear, and in this way where we can also be competent professionals and have any number of ACEs ourselves. So kind of, you know, it wasn't, here are the people we work with, the fellows trauma over here, and here's us. It was, we're also a mix of that, and the people we work with are a mix of that. And so being informed is really going to help everyone, and that we may also be going through that, and that's okay too.
Any other sort of salient points from the last session?
One thing that is a visual that she brought was the visual of the baby elephants being surrounded by all of the mama elephants and their family, and the impact that it has on the baby elephant to thrive in their community. And I'm not saying it as lovely as she did, but for those that were in the room, I mean, if someone else could elaborate, but I thought that visual of just having support systems, so speaking to having someone to talk to about your difficult feelings, or someone that stood by you, just having that support system and how important that is.
I wasn't here for the last one, unfortunately, but what I'm hearing today is excellent information, and most of that visual you just gave me. So this really reminds me of the intersection between prevention and recovery support, because it's all kind of the same. We're all doing the same work wherever anybody is on the addiction spectrum. So that's awesome. Thank you.
And thank you for making that connection, because I was thinking about that too, and how, you know, everyone needs it, right? These are all, everyone needs this, and especially today when our communities are sort of separated and there's a lot of technology, perhaps, you know, preventing face-to-face and that actual human connection, it can be more difficult to achieve. Any others?
Just an observation that underscores the fact that we can't do this all by ourselves, and that opportunities like this
where we have a variety of folks from a variety of services is what we need to be doing on a larger scale. I mean, I couldn't do half of what I do without the partners in our community, but I guess the frustration is, as we start looking at strong community infrastructure and services, some of us aren't fortunate enough to have extensive services. So what we need to do is leverage what we do have so that we're all working together, and that's just a comment.
One thing that stuck with me from Linda was where, in talking with people experiencing substance misuse, and the fact that, you know, those people are looking at their substance use not as a problem, but as their solution to a different problem. And when we start looking at it that way, the picture looks a lot different.
Great. Well, hopefully that's sort of bringing us back to when we were at Nahatica last time with her, will help us sort of spring forward to the next things, the next presenters that we have.
Thank you, Julie, so much for that summary. I'm going to invite Monica up. Those are just the resources that Julie had for that last slide. Just a reminder to fill out that contact list and keep that going. And so we have Monica Gallant here today, who's the Director of Prevention Services for the Boys and Girls Club of the Beacon Valley, and she's going to share a program that they have launched in their community and why that started and what their outcomes are expected to be. Thank you, Monica. It should be
Okay, so, before I was the Director of Prevention Services of the Boys and Girls Club, I was the Coalition Coordinator for Community Action for Safe Teens, which is where our journey of learning about ACEs, Adverse Childhood Experiences, started with the coalition. So, and that's the Substance Use Prevention Coalition. So we're talking about ACEs and Adverse Childhood Experiences, which are traumatic experiences that have the impact or potential to have negative long-term impact on physical and mental health. And we started hearing about it about, 3 or 4 years ago. During our coalition meetings, our school administrators were coming to us, and this was like the height of the opioid crisis, and kids were losing parents, and the school districts were really concerned about the behaviors of their kids. And prior to that, all we looked at was like past 30-day use of substances from our local youth risk and behavior survey data. And when we started hearing from our school administrators, we started looking at the data that we had available to us, which is still the youth risk and behavior survey that's administered at our high schools. And we looked at some of the adverse childhood experiences that are collected in that survey, and we were seeing kids that were experiencing physical dating violence, sexual dating violence, living with someone with a substance use disorder, or domestic violence in the home. And those two blue lines are data that was collected in 2015. It was not on the survey in 2017, those questions, and they mix the questions around a bit every year. But kids, you know, we have and this is Beacon Valley data, which is 4 high schools in our region. And we have, incarcerated parents, kids who don't feel like they matter to their community. And the numbers that equate with the substance use disorder were over 700 kids, high school kids only, and living with someone with a substance use disorder, and 160 kids, high school kids, that had incarcerated parents. And so we realized how serious this was in our community and started targeting or looking deeper into the ACEs. And we've since learned that 18.5% of New Hampshire youth under the age of 17 have experienced at least 2 ACEs. And we've heard how common they are, and, a lot of us have them. We also looked at, law enforcement data, which helps us to define the narrative in our community. We have a lot of alcohol-related arrests and domestic violence. So again, we're targeting, ACEs. And then we, get, drug death data from our Attorney General's office as the chief medical examiner. So we use this to tell our community story. We looked at the, families and addiction characteristics, and there are specific things that happen in a lot of families, but those are more, characteristic of families that have substance use disorder, and which, does have potential to impact mental health for our youth and families. And, when we learn about the family laws of addiction, we learn that these, families are kind of taught not to talk about it, not to trust people, and ignore your feelings. So we do a lot of work to address those issues, which you'll hear more about. So we're a prevention coalition and a Boys and Girls Club. The coalition is the home is at the Boys and Girls Club. And we were learning more about the effects of family substance use disorder on children and families. And we know there are behavioral issues, educational issues, and emotional issues. So let me try not to go too fast. Some of the behavioral consequences are higher risk, which is the same with ACEs, and it's part of the ACEs, higher risk for emotional, physical, and mental health problems. I mean, I'm sure many of you know that the suicide rate is for young people has tripled over the past few years, or several, like 8 or 9 years. There's a higher prevalence of depression, anxiety, and eating disorders and suicide attempts among children of people with substance use disorder than their peers. And they're 3 or 4 more times likely to become addicted themselves to alcohol or other drugs. Educational consequences is the schools see emotional and behavioral learning disabilities, and that's what we were hearing from our school administrators and guidance counselors. Kids are unable to concentrate, so they're not ready to learn. The energy is focused on the person with the substance use disorder. They think they need to take care of their siblings or the parents or whoever else is in the family. And then they exhibit somatic issues, stomach aches, migraines, and other health issues. The emotional consequences are they have a hard time trusting people. They feel guilty. And we hear this from kids that we work with that are in some of our programs, is they feel like that if they were better kids, maybe their parent wouldn't use substances, or there's shame about talking about it, they're confused. Sometimes they just act like they don't care, but they really do. They're afraid and they're not secure. So what we've done is we have developed a number of community-based supports, and we provide outreach to all of our schools and community agencies, and we're fortunate to be housed at the Boys and Girls Club of Silicon Valley. So we have been working for the past year, actually 2 years, on developing a trauma-informed Silicon Valley, and I'm going to share with you how we have done that. But what it means to become a trauma-informed community is to recognize how widespread trauma is, and to recognize the signs and symptoms, and respond by integrating knowledge into practice. So a lot of our schools have been working to become trauma-informed as well. And as someone said earlier, resist doing further harm. So we're trying to change the question from what's wrong with you to what happened to you. And we're incorporating that into our thinking too. When we see a child that is exhibiting certain behaviors, and we're like, what happened? What's the real story? For communities, what we do is we encourage people to develop a trauma-informed environment in the settings like our schools, and our welfare departments, and our law enforcement is a big agency that's working on becoming trauma-informed in our community. Know our resources, know our community partners, we've done a lot of work in identifying gaps in our systems and educating our peers, and that's youth and adults, and integrating a system of community-based support. So this is the bubble chart, we call it our bubble chart. These are our community partners, and we have little boxes for all of our different agencies that are categorized by sectors, which is one of the requirements for the Drug-Free Communities program, which we are a Drug-Free Community Coalition, just had our 1-year anniversary. So we're, it's very exciting. So we've got everybody from parents, grandparents, families, schools, media, businesses. Faith community is a huge representation in our coalition, and they are an amazing sector to have, very valuable, to provide a lot of the supports that we're able to give. We also partner with the recovery community too, so that's a real important partner of ours. This is just a little graph showing where we spend our time. So our coalition meetings are the least amount of where we spend our time, which is how it should be, I guess, right? We spend a lot of our time in outreach or mentoring events and providing education and training throughout the community, and 40% of our time is on youth leadership, which a lot of our partners are in this room. As a teaching tool, what we have done is we've shown the film Resilience, and this is a really great teaching tool. If you're looking for something that can start the conversation about adverse childhood experiences, I highly recommend showing this movie. It is available through the Department of Ed Office of Student Wellness at no charge. And some of our community level trainings, we've done a lot of training, and we were fortunate enough to have Lindy Keller come and do a training for one of our school districts. And we always open up our educational opportunities to the whole community, so it's not just, anything that we do is open to everybody. And if you haven't been to Lindy's training on addiction recovery in families, I know she holds it 4 times a year up here in Concord, but I think we were the first school that she did a full-day training in Milford. So we had 100 school staff that were participated in that, and they were amazed. They're like, oh yeah, they can identify all these kids. We also did, so this is part of our developing a trauma-informed community and working to provide tools using a strengths-based approach. We brought in Charlie Appelstein. He is from the Salem area and great educator, and also Bonnie Harris talking about childhood behavior, and really good feedback on these 2 presenters. We engage in community campaigns, so our kids are involved in helping us to develop these programs. And we started a Lock It Up campaign with our medications and alcohol. So this is a billboard that we have in our community. And we have a youth empowerment service team called the YES team, and this is our youth leadership arm of the coalition. We've engaged in activities like suicide prevention, mental health awareness. A youth summit we held recently, just a couple weeks ago, we had 80 kids. Middle school kids. It was facilitated by high school kids, and it was a result of a couple of our high school students attending the Dartmouth-Hitchcock Youth Summit earlier this year, and they wanted to bring it back to our community. So it was approved as a field trip for 4 of our middle schools, and the objective is to begin satellite teams in each of these schools. So, and they're all ready to do that. We have advisors in each school that will help us to do this. And people listen, you all know people listen to kids when they talk about that kind of stuff. So our kids are involved with the media. They've been on WMUR several times. They engage in advocacy training and advocacy work. They, as a result of attending a Teen Institute Leaders in Prevention Weekend retreat, they decided to plan a Hope Fest, which is a bullying prevention activity. And it was a 5K and a festival that they did in our Milford community. It brought in over 200 people to one of our local parks, which was great. And the kids, they just want to do more, so it was excellent. They also engage in fundraising activities. This picture down here collected over about 2,000 bags of clothes as a fundraiser, and they were very involved in that. This is a pet project of mine. This is called the Children's Resiliency Retreat, and this is a retreat program for kids that are directly impacted by a loved one's substance use disorder. And we hold this retreat at our club in Milford once a month during the school year. It's a full-day program. And here, kids learn about the disease of addiction. And they learn that it's okay to talk about it. It's okay to have feelings, and it's okay to their feelings are validated, and they learn how to express their feelings appropriately. We have supportive education session is where they learn about the disease itself. We have a social emotional learning session where we use the positive action, evidence-based curriculum with the kids. And we do life skills where they learn how to cook, they do community service activities.
Mom, what age range do you?
This is grades 1 and up. Yeah, so, if we have high school, we do have high school kids as mentors and high school kids in the program, so, it's whoever needs it. We started with grades 1 through 8, but, high school kids need it too, so. So it's open to anybody. And we have about, I would say, 35 to 40 mentors that are part of this program. And they are amazing. When they start coming, they keep coming. So a lot of times we have too many mentors. Is that possible? Because they're like, they want to be there. They want to be there with the kids. And we just started our 3rd session. So we piloted it in January of 2018, ran our first full session September through June of last year, and we just started that 3rd. And the first 6 months, we averaged about 12 kids. Now we're up to 27 kids in the program.
A quick question, when do you do this on a weekend?
Yes, it's a
Okay.
full day on a Saturday. Yeah, and the support from the community has been amazing. There's no federal or state funding that goes towards this program. It's all been funded by community support. So it's a pretty incredible program. And then in the afternoon, we do fun things like art therapy, animal therapy, dance, music, all kinds of outdoor adventures, all kinds of stuff. And the kids are really developing some nice relationships with their mentors. And we also just started an Alateen group about 5 weeks ago. So that's another, and these were all identified as gaps in our community. So we were really excited to be able to bring these supports to the community. Some of the things that they learn in Alateen and the retreats is it's called the 7 C's. They learn that they didn't cause this disease, they can't cure it, and they can't control it, but they can learn to take care of themselves by communicating their feelings, making healthy choices, and celebrating themselves. And these programs really have the potential to reduce mental health issues among our youth, and they're developing peer leadership skills and peer mentoring skills. So we have a set of twins that they haven't missed a day. They're so proud that they have had perfect attendance to this retreat program. They're 10 years old. They are spokespeople for this program, and we held an Overdose Awareness Day this summer event on Overdose Awareness Day, and they were public speaking at that event, and they're great peer mentors. So some of our outcomes, we have increased the community's awareness or knowledge of ACEs. We had over 400 adults attend all of our, resilience documentary film viewings or training. We've increased community collaboration with the coalition. Our CAPS Yes team is really has a increased sense of purpose. They're developing workforce skills, community engagement, leadership, service, and advocacy. They're very excited to go to DC with us next February. We've reached, over 300 youth and adults through their leadership efforts. And our Children's Resiliency Retreat, we've had over 35 youth in and through the program. They are increasing emotional awareness, improved mental health, peer mentoring, civic engagement, advocacy, and community collaboration. Let's see. So some of our testimonies, and this just speaks to the efforts of the coalition, collaboration. Our superintendent, sees our value. One of our superintendents, we work with 4, actually they all do, but I just got a testimony from one. They appreciate the services that we're able to provide to their students with leadership development and things like that. The kids, these 3 testimonies on the bottom, the kids are expressing how the program is helping them, so we collect testimonies from them as well. And one of our resources is SAMHSA's concept of trauma and guidance for a trauma-informed approach. And then these are some of our other, so we've got our guests, our retreat, SAMHSA, NIDA, New Hampshire Drug and Alcohol Drug Treatment Locator 211. And then this is our little quote. Questions?
Yeah, nice job.
So thank you to all of our partners that are in the room that have helped us accomplish all this. Sergeant Bruss, Staff Sergeant Bruss is a great resource for us. Provided us with a lot of coaching through the years. And Marissa?
Thank you so much, Monica, for sharing. So I'm going to invite Carrie Lowe up to talk about the program that they have going on in the Lakes region.
Hi, everybody. So ACER is Adverse Childhood Experience Response Team. I'm the coordinator, Carrie Lowe. This is a collaboration between the Family Resource Center, Laconia Schools, and Laconia Police Department. So some of this is, I'm going to go through these really quick because this is review for you all. You've already heard this. We realized at the Family Resource Center and child care professionals and other people involved in early childhood that brain architecture is shaped by early experiences. Those simple skills come first, and then those more complex skills are built upon the simple skills. So the strong foundation improves the odds for positive outcomes, and a weak foundation increases the odds for problems later in life. And then we realized that toxic stress, certain types of stress can weaken the brain's architecture. And so those experiences, those ACEs, such as abuse, neglect, or exposure to violence, can cause toxic stress responses in the brain, with those lifelong consequences in learning and behavior, which is what we were seeing in schools, and in other health conditions later in life. So, and then the ACEs study was something that we used for, examining why is it so important that we address ACEs, and that's all types of abuse, neglect, and other traumatic experiences, to include family dysfunction. So here's what we were seeing in Laconia. Laconia police were responding to incident calls like domestic violence situations or drug overdoses. They had few, if any, options to help children present in situations. And this was something when I was the substance misuse prevention coordinator in the Winnipesaukee region, this was a conversation that we were having a lot with emergency responders, is that often they were saying that, they were going to events and, they would solve the immediate crisis, but then look around and there'd be 3, 4, 5 kids standing around that witnessed what happened. Whether that was a drug overdose, if it was a domestic violence situation, mental illness related, so many different things that kids were experiencing, really traumatic events, and the police officers didn't really know what to do about that. So leaving and wondering, they may have made a call to the domestic violence shelter. They may have made a call to DCYF, but not really knowing what happens to those kids after that, and are they connected to what they need. So police officers weren't educated in trauma, and they were unaware of the resources to connect the children to, and other emergency responders as well. So the bulk of calls that Laconia Police respond to are domestic violence related. Laconia schools, we're seeing a high percentage of students entering kindergarten and preschool with 4+ ACEs. So this is preschool and kindergarten, kids coming in with 4 ACEs. And if we go back to the ACEs study, overall they were seeing a percentage of people that had been experienced 2 ACEs. Adults that had experienced 2 ACEs that were seeing significant consequences based on that. We're talking about really little people with 4+ ACEs. So, and some other data that I have, Laconia's kind of got a bad rap over the years. They've been in the limelight a lot for having significant problems. So we don't really want our data on a slide. I can present this to this room, but we're kind of, cushioning ourselves and really just we want to focus on the solutions and not so much on the problems. But some of the data for Laconia, so in 2017, Laconia Police responded to 196 domestic violence calls, 453 juvenile involved calls. So many of those are domestic violence related, and that makes sense when I talk about the referrals that I've got so far with ACERT. It makes sense because most of the referrals that I've received so far have been children with what the schools and the police are referring to as behavioral problems. Obviously, behavioral problems are but a symptom of a bigger issue, and that's years of traumatic events. And then those juvenile involved calls also can be truancy. They can be, it can be violence with other juveniles in the community, can be sexual related assault, a lot of different things that happen when it comes to those juvenile involved calls. And then also in 2017, there were 154 overdoses with 8 deaths. That number is declining for a number of different reasons. We're not seeing as many of the overdose, but there's not a decrease in substance use. Some other things, 57% of Laconia schools population are eligible for free and reduced lunch, so we do have a high poverty level in Laconia for sure. And that sometimes can be related to higher ACEs. Obviously for families that are under financial stress, that can lead to other problems. That can lead to substance use, that can lead to child abuse and neglect. Sometimes the neglect is not even in the, technically, but the fault of the parent when they're having to go to work and maybe leave their children unattended or leave their children with somebody that's not necessarily the greatest person to be watching their child, but they have to have income for their family. So there's so much around this. So 6% of students in Laconia experience homelessness. So that's a pretty high percentage. And are eligible for the McKinney-Vento Act support. 7.2% of student population is court involved. 45 open juvenile justice cases, 64 open DCYF cases. By the way, Laconia is a population of roughly 16,000 people, to put that into perspective. We modeled ACERT on the Manchester ACERT, which is 7 times as large as Laconia. So when you put that into perspective, we have a pretty small population for the things that we're seeing. 29 CHINS cases, child in need of services cases, which are specific to habitual and willful truancy. Over 40 middle and high school students receive individual LADAC counseling on site annually. Approximately 20% of all students receive Tier 2 group interventions, which you probably have learned quite a bit about if you're working with the Office of Student Wellness in any of your schools. And those are services that are provided by LADAC, social workers, counselors, and school psychologists, 20%, so 1 in 5. Approximately 25 middle and high school students receive individual mental health counseling on site, and those are students that have barriers to accessing those services outside of school. So data over time is showing an increased need for school-based mental health support and home visits by school-based social workers. Those numbers have actually, the visits by school-based social workers have tripled, and then the mental health supports have doubled in the last 2 years. So then also some of the information we were looking at to why we need to be addressing ACEs was the YRBS data, and 5.7% of Laconia High School students who did not go to school because they felt unsafe at their school or on their way to or from school in the last 30 days. 11.4% of students were threatened or injured with a weapon on school property in the last 12 months. 27.4% of students were in a physical fight during the last 12 months. 31% of students were bullied on school property in the last 12 months. This all relates to the referrals that I've been getting through ACERT, have been school resource officers have seen, kids that have been bullied and are, it's interesting because we anticipated that we were going to get the referrals for the kids that experienced the traumatic event right then. The referrals we're getting are more related to the behaviors of the students who have experienced traumatic events over time. So it's ending up being a lot more, we anticipated ACERT was going to be a prevention, not preventing the initial traumatic event that happens, but preventing the toxic stress related to ACEs over time. So we wanted to mitigate that toxic stress. And it ends up that, right now, we're catching those kids that haven't been caught previously. Addressing what's going on with them currently. And we're building the plane as we're flying it. So, or flying the plane as we're building it. Surprised I caught that and didn't just go with it. So really just whatever's coming up is what we're addressing in the moment and connecting kids to the resources that they need. So 22.8% of students in Laconia High School seriously considered attempting suicide over the past 12 months. Another thing that we're looking at is that, significant cases are happening in our youth's lives and need to be addressed. 17.5% of students had either parents or other adults in their family who had been in jail or prison in the last 12 months. And then less than half, so 43.8% of students strongly agree that in their community they feel like they matter to people. So again, that's and that was some of the data that you shared from your community as well. So that's really important because it is all about those social connections and getting kids connected to the resources that they need, and that resource can be one adult in their lives who cares about them and can help be that person to listen and guide them beyond the problem. And then 8% of students have slipped away from their parents or guardians because they were kicked out, ran away, or were abandoned in the past 30 days. So, in thinking like that, that's almost 1 in 10 students that have been kicked out, ran away, or were abandoned in the last 30 days, not in the last 12 months. So that's some pretty significant data, and it really speaks to the reason that we need to be addressing ACEs in our community. So the rest of this is it goes back to the ACEs study. So according to a 2-year survey conducted and released last year by the Resource Center for Child and Adolescent Health, 23.4% of New Hampshire children have been impacted by one traumatic event. 18.5% of children statewide have been affected by 2 ACEs. So that's significant enough in itself, but then when we look at what Laconia schools are seeing and that kindergarten and preschool students have 4+ ACEs, that's pretty significant. So we want to be mitigating the effects of trauma. The key to forming strong brain architecture is the observe and return relationships young children have with supportive adults in their lives. And both of the presenters before me spoke to that importance of having somebody to talk to, somebody to be there for the kiddos to mitigate that trauma that they've been through. We can't change anything about what they've already been through, but what can we do to mitigate that, to address that, to help them feel supported through that. When children reach out for connections and communications with adults reciprocate, the blood process continues, wiring the brain with connections needed for healthy development. So we want to make sure that it's in kids' lives. And then the prevention and promotion, so this is what we want this ACERT to be. Highly specialized interventions with families as early as possible to decrease the effects of long-term toxic stress. We want to put developmental and behavioral health at the forefront when talking about children. So addressing, children can already have been exposed to many ACEs. Their developmental, they could be delayed developmentally because of the environment that they've brought up in, and we need to address that. We need to get them the supports in place. Is that early supports and services? Is it school-based supports? Whatever that means, getting, being on a individualized education plan. And then addressing their behavioral health. So children that have experienced these ACEs, we don't want to be kicking them out of school, suspending them from school, and not getting them the supports that they need to address something that wasn't their fault to begin with. Helping them with that self-regulation and being able to manage what they've been through. So we want to ensure safe and supportive environments and programs for children to develop and learn and mitigate the toxic stress and health disparities by creating a shared vision and plan among community members and sectors. So this is what we're working on, developing that trauma-informed system. So what does that mean, connecting them to services? So this is, I'm lucky enough to be housed in the Family Resource Center of Central New Hampshire, where many of these supports are happening right in the building that I work in. So home visiting programs, like the type program, it's a prevention-based program that is pre-DCYF. We get a lot of our referrals from DCYF. Now a lot of the referrals are coming from ACERT. And it's so that DCYF doesn't have to open a case because the supports are being provided before that happens. Parent education classes, sometimes, parents don't know what they don't know. If generation after generation of abuse, neglect, of not getting the support they need, not having that serve and return relationship, when parents come to parent education classes and they're faced with no blame and judgment of just, we're going to meet you where you are, here you are, everybody's got a story, and learning that knowledge of parenting and child development is, parents walk away like signing up for every class once they've been in a class, and learning so much from each other. Domestic violence supports, like we said, there's a bulk of Laconia calls are domestic violence related, so getting families connected to the Women's Crisis Center. Substance use disorder treatment and recovery support. Ironically, none of my referrals have been substance use related so far. I don't anticipate it's going to remain that way, but my first referral came in September 26th, so we'll see. But so far it hasn't. Sometimes there's issues with previous substance use, maybe an incarcerated parent, but currently no substance use in the immediate family, in the household. Mental health support, counseling for children and or family, depending on what the family is open to. We know that a lot of times what we're hearing is that they're looking for services and supports for the child is the problem. Okay. Thank you. Supports in schools, we're lucky enough to have a release that is between Laconia Schools, Laconia Police Department, and the Family Resource Center. So when I get that referral, I can instantly reach out to schools, let them know that a child has experienced a traumatic event, and be sure that they're getting the support they need, whether that's with social workers, making sure that their behaviors are addressed in an appropriate manner rather than being suspended from school and put back into a tough situation. High-quality childcare, sufficient income and resources for low-income families. So if children aren't in childcare, getting them connected to that so they have that safe, supportive environment. affordable housing, a couple other families I'm working with are homeless, so getting them, that's a huge traumatic event in itself, never mind everything else that comes with that. After-school care program, Boys and Girls Club, Big Brothers Big Sisters, mentor programs, Project Extra in the schools. We want to connect these kiddos to any of the support we can possibly connect them to. So we use Manchester's theory of change because we don't want to recreate the wheel. We're replicating their program. They came and did a program for us, the levers of the agency partnerships, systems, and professional development. Strategies is respond to family crises, get in there and help them connect to what they need, link the families to the services and opportunities. The protective factors, so Manchester's protective factors were parental resilience and concrete supports in times of need. Coming from the Family Resource Center, we operate on this strengthening families approach of building those social connections, super important for the whole family, not just the child. The more that parents are connected, the less likely they're going to be having abuse and neglect in their family when they're connected to other people that can help them through tough times. Knowledge of parenting to child development and social emotional competence of children. So we're looking for programs that are offering that. Many of that is in the services that I already demonstrated, but we're constantly looking for other services and hoping to fill gaps when there's things needed that aren't already there. And then the results will be strong, resilient families and mitigate those effects of AIDS. So in November 2018, we had a presentation to Laconia service providers by Manchester ACERT on ACEs and the success of their program and how they were operating. And they also discussed some of the challenges and the ways that they tweaked it. And, so we really looked at we created a steering committee so that we could look at how is this going to operate in Laconia? How does this fit? The Family Resource Center agreed to pilot the program. A release was created between Laconia Police, the Family Resource Center, and Laconia Schools. Coordinator was hired, and then the police were trained in the program and getting the release signed. That was really like the biggest struggle with creating that program because it had to go through Primex, the risk management organization, and getting that to be what it needed to be took a lot of time, believe it or not. And you see this in community collaborations as well. Those releases are tough, getting organizations able to share information about families. So the program officially launched on September 3rd. There actually was a delay in training the police. There was an event at Laconia Police Department that really traumatized a lot of our local police, and they had to address their own trauma before learning about ACERT and rolling this out, putting the oxygen mask on themselves first. My first referral was received September 26th. And these numbers need to be updated. I'm working with 9 families. 9 referrals have been received so far, and 8 of 9 families are engaging with the ACERT program and getting connected to resources. So there are actually 20 children that have been impacted by the program, referred to maybe more programs than that, but we'll go with that, referred to 31 programs and connected with 21. So they don't always connect with every program that I refer them to. That's always family choice, but that's a pretty good number. And in the future, we're going to have trauma training for the entire police force in January 2020, and continue to create a trauma-informed system of support. We want to be able to educate our whole community on when Julie mentioned the retraumatization. That is real, and I saw it for myself in supporting a family just the other day to apply for city welfare. I was absolutely horrified with the way that the family was treated in front of me with the service provider there. So we have to train our community. We're doing a great job. We're really doing a great job of getting the word out there. So many people are on board with us, but there are still some sectors, I won't say sectors. There are some people that just don't understand that they're re-traumatizing the families that we're trying to help, and they can't move forward if they continue to be re-traumatized.
I think, also some of the struggles, if you just go back and slide for me just for a minute, on the SAP Counselor at Portsmouth High School, and we work collaboratively with the police department and all the community members, but as you know, the releases are really a barrier to getting those services met. So
Yes.
you had indicated that was there an agency or something that facilitated those releases?
So Primex is the risk management company that, that police departments and a lot of other emergency responders use.
Okay, so is it the police department that initiated those releases? Was it like an MOU or?
It's an actual release that, Primex created the release based upon what Laconia Police were asking for.
Okay, okay. So what the legal ramification, or what the legal parameters are around what's discussed? Okay.
So this is our workflow, and you have that. I won't get into this because it'll take too much time, but basically Laconia Police respond to event, ask the family to sign the release. If they don't, then Eric Adams, who's our prevention enforcement and treatment officer and has a great relationship with a lot of the families in our community, he'll reach out and try to get them to sign. If they still won't sign, then we'll end the process, but they do get a trauma pamphlet with them, and they're still able to reach out to me at a future time, so it doesn't mean they can't ever reach out for support. And then I connect with the family, connect with the school, go out to the family with the necessary partners based upon the nature of the call. So this is our steering committee, solid steering committee. This is great that these organizations are working together. Laconia Police, Laconia Schools, New Beginnings is our crisis center, domestic violence, Navigating Recovery is our recovery center, DCYF, Child Advocacy Center, like they have been a tremendous partner. Lakes Region Mental Health, Health First, the Boys and Girls Club, which is also Lakes Region Child Care Services in our community, they recently merged, and the Family Resource Center. So, and then all of our referral programs, and I put not inclusive because this was just, okay, what are the ones that I'm referring to most often? Boys and Girls Club has offered free kids. Thank you. I'm doing all right. Boys and Girls Club will get kids in for free, even if they're an ACER referral, even if the family has the resources, just for the time being, to get them in immediately, to make sure that they're getting connected to those supports that they need in safe after-school care. So they'll take them in. Lakes Region Child Care Services has agreed to have, while they're waiting for our families to get the child care scholarship, they'll get kids in if they have an opening, obviously, because that can be a tough spot as well. The Head Start, early Head Start, school social workers. Now I know the school social workers so well through the referrals that every referral that I've had has had school-age children, so working with those school social workers. Big Brothers, Big Sisters. One of excuse me. One of the thank you. One of the kiddos that I'm working with, very, very traumatic event for this kiddo. And Big Brothers Big Sisters, they have, I can't remember if it's Bigs and Blue or Bigs and Badges, but he got a chief of police for his big after an incredibly traumatic experience. It's just perfect, you know, because now this boy will grow up knowing that police are not the enemy, that they're there to help you. They're not there to just arrest your parents. He can understand the difference of, you know, the police being there to support you and help you, and he'll probably have a lifetime friend. New Beginnings, Navigating Recovery, Community Action Program, because concrete support in times of need is also super important. Families need the resources to be able to survive. If they don't have the resources to survive, then that's why these things happen. They have to have a roof over their head. They have to be able to meet their basic needs. Health First offers, they're our federally qualified healthcare center, and they offer primary care, mental health services, medication-assisted treatment. They have a health insurance navigator. I work with them a lot with the family. Lakes Region Mental Health Center, early supports and services for those kids for their developmental needs. Area agency, developmental disability and acquired brain disorder services. A lot of times the parents of the children have some, you know, developmental disabilities themselves and could use some support, a case manager to help them and get some support in independent living skills. Comprehensive family support, that's the Step Ahead prevention program, pre-DCYF, parent education, Laconia welfare, Belknap House, Carey House, those are the shelters in our community. Just got 2 families into Belknap House in the last week, So that is a roof over their head, thank God. Then you can really start to work with the family when they have a place to live. DHHS for some more concrete supports, food stamps, TANF caregiver grant. I've had, some family members that have agreed to take on a child after an event and getting them that caregiver grant so that they can get some money to care for that child. President Farm for camperships, veteran services, Service Link, and like I said, not all inclusive. So the anticipated results are an increased awareness of and improved access to available services and resources, identifying and implementing needed services to better address the needs of children and families, greater efficiency and less duplication of services, enhanced relationships and ability to share information among providers, agency, and partners, increased positive interactions with families, and creation of natural support systems, because that's super important. The services might not always be there, but if we can, increase their natural support systems. Parent education groups is a prime example of families supporting each other and having lifelong friendships with other parents in the group. And, it's magical. They're bringing in clothes for the other families, they're offering rides. Those natural supports and social connections are so important. Informed and proactive agencies eager to work collaboratively to improve outcomes for children and families. And that's what we get with that steering committee. It's just, it's solid. How will we evaluate? Steering committee meets once a month to review the process and make changes as needed. We have MOUs between the steering committee members, and they'll be reviewed as needed for applicability and comprehensiveness. We wanted initially just to have an MOU, but we'll be looking at, okay, what more can you give and what more can we give, and how can we work together to make this work? Ongoing data tracking regarding the number of referrals to ACERT, families connected, number of referrals to programs, and then engagement with those programs. We'll review what gaps still exist and create a plan to address them, and track how many first responders and other service providers are trained in ACEs and trauma-informed approach. And that's it. Any questions?
So you mentioned, I think, 25% of the younger, kindergarten, grade 1 kids have 4 or more ACEs.
I don't have the exact number on that, Mackenzie didn't give me that, but it is a high number, high percentage.
They have 4.
Yeah, 4 plus, yeah.
So how are you measuring that? Like, how are you collecting that?
The Laconia schools screen kids as they're coming into preschool and kindergarten. They also screen kids as they're coming in from another district. Anybody else?
Wait, I have one. Step ahead, is that, is that a organic, organization that Laconia has, or is that a?
So it's comprehensive family support, so I believe that every, region has
that?
comprehensive family supports. It's just called, the
That's
program
what
is called something different.
Okay.
So in our region.
Thank you.
All right, thank you.
Thank you so much. I really appreciate both Carrie and Monica sharing their community's approaches to this. I think it really helps the community practice as a whole learn some techniques that they might not know were happening in other communities that are working, and you have the contact list, so you can connect if there's any questions following up. So I'm going to hand it over to Lisa Nure, who's going to lead us for the next part of our meeting discussion.
Okay, thank you. I want to thank the speakers again. That was a lot of information. We've been kind of sitting and listening to a lot, both during the last session and now. So now we want to kind of just give you time to talk and process about what you've heard and maybe set some priorities for yourself and for your community amongst your peers. So if you look at this handout, this shows you all the things that we talked about the last session that you shared in the group about what is happening in communities in New Hampshire around ACEs and how they kind of align with substance misuse prevention work. On the second page, the bottom half is just a couple of things I pulled, from the CDC and SAMHSA around their best practices, around ACEs. The last two pages are some of the gaps that you identified in doing some of the, more ACEs work. So this is kind of what we talked about last time. And then this is your guide for today. So I think I'll tell you what the small groups will be in a minute, but this green table is if you do want to talk about more things that are already happening, you can kind of fill that in for yourselves in your small group. But basically, the number 2 and 3 are the purpose of the discussion now. So, you know, what do you think, based on everything that you've learned, everything that people are already doing in other communities, what's the priority for you? What readiness steps do you need to happen to kind of move those things forward? And then a short list of topics that you're interested in learning more about. And this will be fed back into the community practice so we can continue to support your work around ACEs. So, any questions before we get started in the small group discussion? Okay, and I will do that thing where I'll ask everybody to share. So if you want to kind of, you know, identify a note taker and someone who can share and report back to the larger group, that would be great. So I think with the way the tables are now, the easiest way is to have these two tables kind of just turn and face each other, those two, and then all the way up here. And if you guys, because they're kind of from out of state, the 5 of you might want to just kind of maybe spread yourselves around to some of the other groups. It's up to you. Or you can just talk with out-of-staters about your work. So talk about anything else that's going on around ACEs that you're excited about or want to learn about. Set some priorities for yourselves and what readiness steps and what more information you need to make it happen. And we'll convene in about 20 minutes.
A little early.
We should mingle. Is somebody on the phone? Is somebody on the phone?
Oh, I don't know.
We're gonna mingle.
So I'm